In the studio, we have Dr. Satish Narayan. He is a board-certified psychiatrist and an addictionologist, and he is here with us to discuss about treatment-resistant depression. Dr. Narayan, can you tell us a little bit about treatment-resistant depression?
Well, thank you for having me today, Dr. Kikeri. I'm very excited to talk to you about depression and especially treatment-resistant depression. Well, treatment-resistant depression is essentially defined as a depression as an illness which has not responded to at least 2 different antidepressants at good doses for a reasonable good period of time. In other words, people have failed 2 options.
Having said that, do we have any other treatment options for those patients?
Right. Since depression is a serious, major medical problem in mental health, I think we need to have many options. And one of the options we have is psychotherapy. Combining psychotherapy with med management would be a good augmentation strategy, meaning add-on therapy or add-on treatment. Likewise, augmentation is another strategy when combined with other antidepressants and non-antidepressants like thyroid medication, lithium, antipsychotics, to name a few.
Apart from the medication that is normally used, what other treatment options do we have for people who are resistant to treatment-resistant depression?
Right. It is a well-known fact that depression does not respond to the first line of antidepressant. And in fact, there is a study trial called the Sequential Treatment Alternative for Resistant Depression, which gives us guidelines how to treat depression when the first step fails and so forth. We find this 4-step approach. At the end of the 4-step approach, over 30% of patients do not reach remission, which means depression is not knocked out. So, therefore, we need to have different options to help our patients.
Can you elaborate, please?
Yeah. One such option is electroconvulsive therapy, or ECT. ECT is also known as shock treatment. And there's good data to support that. Adding on ECT would be a very good treatment option. There are some newer treatments called transcranial magnetic stimulation, where instead of using an electric current, a magnetic current is utilized, and pretty much this treatment could be done in an outpatient setting. And there are more invasive treatment approaches, like vagal nerve stimulation and deep brain stimulation, where neurosurgical intervention is required. Now, a more exciting approach we have these days, I think, which is not yet FDA approved, is called ketamine treatment. Ketamine has been known to be a well-known neuroleptic anesthetic, which has been known for about many years. And there's good data to support that ketamine may be a new useful tool for bringing patients to remission very rapidly.
I'm very happy to hear that. And tell me how the patients have responded to the ketamine treatment in your literature.
Right. The literature says that ketamine treatment brings patients out of depression very rapidly. For some of the treatment-depressed patients, their remission rates have been robust up to 30% in some of the data, which is very exciting. And that too within a few hours after administering ketamine. So our patients will be much relieved to consider this treatment option. Also interesting to know that this treatment option is a little bit long-lasting and not transient as much. But we do not have long-term data to see how ketamine does over a period of years. That remains to be seen. So, Dr. Kikeri, you are an anesthesiologist, and I understand you do a lot of pain management treatment. And as far as psychiatrists are concerned, we do a lot of collaborative work with pain management physicians and anesthesiologists. Please share with us a little bit as to how ketamine can be useful in treating pain, for instance.
Usually, ketamine actually is one of the old anesthetic medication. It is also called a neuroleptic anesthetic medication, where it is administered intravenously. In the world of chronic pain, it is used to treat a painful condition called RSD.
And RSD stands for?
RSD stands for reflex sympathetic dystrophy. It is an old terminology. Nowadays, it is also called CRPS, where they have burning pain in the extremities it is almost like having even a non-painful stimulation such as touch, clothing, or even a light touch causes excruciating pain. For those patients, they have responded well to the IV administered ketamine therapy.
I see. So, in your experience, do you notice that these patients do become better in terms of the decrease in their pain intensity and tolerance and functionality, I suppose? Is it also long lasting?
They have responded well in the studies that we had, and also the European literature suggests that the ketamine remission for RSD is that's well documented, that the treatment lasts for a long time. And again, like in treatment-resistant depression, it is not FDA approved, but it is also used as an off-label treatment. It is administered in the form of an IV, where the patients come in, they get the IV ketamine infusion over a period of a few hours, under heavily monitored and in a safe environment. Over a period of 3 days, the treatment is done, and they are re-evaluated afterwards. And majority of the patients who receive this treatment have benefited.
That's very exciting to hear, Dr. Kikeri. Sounds like we need to have a collaborative approach because most psychiatrists are not trained in doing anesthesia and it's not within our scope of practice. So I think our patients will benefit if we were able to mutually collaborate together to come up with a good treatment option for treating treatment-resistant depression as well.
I agree with you, Dr. Narayan, and vice versa. Most anesthesiologists and pain physicians are not trained to treat depression. And thank you very much for bringing this exciting treatment option to light. And we want to thank the viewers for taking time to watch this.
Thank you very much for having me. Appreciate it.